Hey YouTube, it's Nikia. You have to excuse my shirt. I got makeup on it. I didn't notice it until I started recording myself. I'm sorry that I haven't done any videos after my surgery. I had a couple complications and I'm still not feeling the best. I have a lot of pain at my surgery site. Um, and I feel horrible. I really do. And I don't regret having my surgery. I think a lot of the pain that I'm experiencing right now is from doing too much. I did vomit once after my surgery, and that was because of my pain medication was crushed and put over some jello instead of like applesauce or something like that. Um, it was my idea, so it wasn't anybody's fault. But I want to talk to you guys about my surgery at Loma Linda University Medical Center, but it was actually at their surgery hospital. My doctor was Dr. Keith Scharf, and my surgery was on 12/30/2016. My surgery weight was 250. Um, the day before surgery, I spent a lot of time looking around, going places, trying to find, get everything that I needed for my surgery. I'm going to get comfortable, excuse me. And I'm not really sure what it look like. I know the camera's there, but you just have to work with me here. Sorry. Um, Pretty much, I try to grab as many things as I thought I would need during my surgery. I brought Gas-X, which I think was the number one thing that I needed during my surgery, but it was really not allowed, so I had to sneak it. I had to sneak it. What I did was which actually I probably shouldn't even say because now they're gonna be checking people's phones. What I decided to do, ouch, I got an owie on my finger, is I have a case like this on my phone. And what I did was I put my patches here so they couldn't see it. And then I would just close my um, little rubber part back up, and you couldn't even tell that they were in there. But that's where I kept them. Um, I didn't use them very much because at one point I kind of felt like it was making things worse. Um, I did try to get up as much as possible, but first let's backtrack a little bit and go back to where before I had my surgery. When I got there, hold on a minute. I just took my Band-Aid off and it's not looking good. I arrived for my surgery. They took me and my husband downstairs into a room where they prepped me. They had me put on the gown and, get ready and everything, and my slippers and my cap and all that stuff. And they put these bands on. I believe these bands are called P6 bands. And when I get a chance, I will show you what that looks like. But it's like a little knit band that has a little round, like, ball on it. And it pushed about right here on each wrist, the acupressure area for nausea. They put a patch behind this ear, which I'll show you some clips. I'll add in some clips, after this so you can see what kind of happened and where the patches were. They also gave me a medication, which I don't remember the name of the med, into my abdomen to help numb it which they did that during the surgery, so that I would have less pain at that site after the surgery. They had me take a pill called Emend, and that I took, I think, 4 hours before my surgery to help with nausea. And also will show you, I still have the box from that. That pill cost $147, which my insurance did pay for. I guess the patch behind my ear was called a scopolamine patch. Don't quote me on that, I could be saying it wrong. So they did all those things. They gave me the medication to put me to sleep. And it's like, I don't really remember much. I don't. When I came up from my surgery, I remember waking up, but I still was kind of drowsy and kind of out of it. I think once I woke up, which was like hours later, because my surgery was like at 12:30, 1 o'clock, and I think I didn't do my next little video until about 4 or 5 that day on the 30th. They had also put like a respiratory monitor on my neck since I had the PCA pump, which I was going to have for 24 hours. I felt like my pain was really, really well managed, as well as my nausea. I still felt nausea. I'm trying to remember if they gave me any fluids the first day. I think they did eventually start, yeah, because usually most people stay for 24 hours. I ended up staying for 4 days. What happened was I was so nauseous, which I kind of knew that I was going to be nauseous because I have 4 kids, and every kid that I have, oh, look at that. That looks horrible. I should have changed my shirt. Sorry. It's so stormy and this shirt is warm, so I didn't want to take it off. But I was nauseous with every child that I had. So I kind of knew that I was going to have stomach issues and that I was going to be nauseous, and that's exactly what happened. I couldn't get the water down. I could barely get the broth down. They gave me IV medication to kind of help control it. They also used alcohol wipes, which, me being a nurse, I've never, and I know I work with babies, but on occasion I work with adults. I've never heard of using alcohol wipes to help get rid of that urge to vomit. And they really worked. They worked. I still have them. I carry them in my purse. I'm telling you, they worked for me, you know. And it was just amazing just to learn all the different things that they use to help control that. And then I ended up getting an IV infiltrate, which happens. You know, it's not any one particular person's fault. It could have been my fault. It was in this hand right here. It just blew up. It blew up. Blew up, blew up, blew up. They wanted to give me like 24 hours of Toradol, which is an anti-inflammatory, to get that swelling down, especially with it being my right hand. You know, I need that hand. So they did everything that they could to get the swelling down, and the swelling did go down. They also gave me this, which they they call this a SpongeBob thing. And what you do is you put your arm in here. I'll show you. It's like this. See? You know, it's in there. And then my hand's up here, and it just kind of, I had to sleep with this, and then have it in there during the day or when I was awake to kind of get the swelling down. And, you know, it helped, and it still helps, even though it's like 3 weeks out and I'm still having issues. But I'm glad that it was there. I mean, my nurse practitioner is awesome. Stephanie Keith is amazing. If you are thinking about having surgery and you live in Southern California, I mean, even if you don't, I'm telling you, Loma Linda University is the bomb. They are the best. I would not have wanted to have surgery any other place. And I'm sure there's other places that are awesome out there, you know, but working, and it's not just because I work there either. I'm off work right now anyways. But that was the only place that I truly felt that I could go to get good quality care and good, you know, quality treatment. You know, whether it's from the physician or the nurses, just amazing. The cleaning staff was polite and professional. The nutrition services were nice and professional. It was just amazing. I wouldn't have gone any other place. So thank you, Loma Linda, for giving me awesome care. Okay, I'm going to include the clips a little bit later on so that you can see me before I had my surgery, after I had my surgery as well. See you guys soon.